You look exhausted. Are you all right?
I don't know. I just haven't been feeling like myself lately. It's been getting worse these past few months.
What's been happening?
It's a lot of things. I'm tired all the time, no matter how much I sleep. Even simple things feel like they take so much effort.
I've noticed you've been slowing down. Anything else?
Yes, I've been gaining weight even though I haven't changed how I eat. And I'm always cold. Even when everyone else is fine, I'm freezing.
That doesn't sound normal. Did something trigger it?
I don't think so. My skin has gotten so dry, my hair keeps falling out, and I can't focus like I used to. Sometimes I forget simple things. It's frustrating.
That must be really hard for you.
It is, and my periods have been heavier than usual. I just feel off, like my whole body is slowing down.
Have you thought about seeing a doctor?
I think I need to. This isn't just being tired. Something feels wrong, and it's affecting everything. Work, home, even how I feel about myself.
Then let's go tomorrow. Whatever it is, we'll deal with it together.
Thank you. I just want to feel normal again.
Mrs. Robertson, the doctor is ready to see you now. Please follow me.
Hello, Mistress Robertson. It's nice to meet you.
Hello, doctor. Thank you.
I understand you haven't been feeling well lately. Tell me what's been going on.
It's been several months now. I'm constantly tired, even when I sleep well. I've gained weight without changing my diet, and I feel cold all the time. My skin is dry, my hair is falling out, and I've been having trouble concentrating. My periods have also become heavier.
That sounds very uncomfortable. Thank you for explaining everything so clearly. We'll go through this step by step. Before we continue, I'd like to review your vital signs and do a physical examination. Is that all right?
Yes, of course.
Your blood pressure is 118/76. Heart rate is 58 beats per minute. Temperature is 36 degrees Celsius, and your breathing rate is normal. Your heart rate is a bit slow, which can happen in certain thyroid conditions.
I see.
Now I'll examine your neck and thyroid gland. Please sit up straight and tilt your head slightly back. Your thyroid feels slightly enlarged and firm, but not tender. I didn't feel any nodules.
Is that bad?
Not necessarily. It gives us clues, but we'll confirm everything with tests. I also noticed that your skin is quite dry, and your hair looks a bit thinner than usual. These can be related to hormonal changes. Your reflexes are present, but the relaxation phase is a bit delayed. That's another sign we sometimes see in thyroid issues.
I didn't realize all of this could be connected.
It often is. Based on your symptoms and what I'm seeing on the exam, I'd like to order some blood tests, specifically your thyroid, hormone levels, and an ultrasound of your thyroid. Once we have the results, we'll know exactly what's going on and how to treat it.
All right. I just want to feel normal again.
And that's our goal. We'll take good care of you. Welcome back, Mrs. Robertson. It's good to see you again. How have you been feeling since our last visit?
Still tired, but I'm glad the tests are done. I've been a little nervous about the results.
That's completely understandable. I've reviewed all your lab work and the thyroid ultrasound, and I'd like to go through everything with you step by step.
All right, I'm ready.
Let's start with your thyroid profile. Your TSH level is elevated, and your free T4 is low. This combination tells us that your thyroid gland isn't producing enough thyroid hormone.
So that means
It means you have hypothyroidism, which fits very well with the symptoms you've been experiencing. Fatigue, weight gain, cold intolerance, dry skin, hair loss, and difficulty concentrating.
that explains a lot.
It does. We also checked your thyroid antibodies, and your anti-TPO antibodies are high. This tells us the cause of your hypothyroidism is most likely Hashimoto thyroiditis, an autoimmune condition where the immune system slowly affects the thyroid gland.
My mother has that. I was worried it might be something similar.
Yes, and that family history is important. Hashimoto's often runs in families, so your results are consistent with that pattern. Your thyroid ultrasound also supports this diagnosis. It shows a mildly enlarged gland with a heterogeneous texture, which is typical in chronic autoimmune thyroiditis. There were no nodules, which is good news.
I'm relieved to hear that.
We also checked your lipid profile, and your LDL cholesterol is a bit elevated. This can happen when thyroid levels are low, and it often improves once treatment begins.
So the thyroid affects cholesterol too.
Yes, it plays a role in metabolism throughout the body. When the thyroid slows down, many systems slow down with it, including how your body handles fats. Putting everything together, your symptoms, physical exam, blood tests, and ultrasound, the diagnosis is primary hypothyroidism due to Hashimoto thyroiditis.
Is it treatable?
Absolutely. The treatment is straightforward. We'll start you on levothyroxine, a synthetic form of the hormone your thyroid isn't producing enough of. It's taken once daily, usually in the morning, on an empty stomach.
Will I feel better soon?
Most people start noticing improvement within a few weeks, and we'll adjust the dose based on follow-up blood tests. Our goal is to get your hormone levels back to normal and help you feel like yourself again.
That gives me hope. Thank you, doctor.
You're welcome. We'll take this one step at a time, and you won't be going through it alone.
You're back. How did everything go at the clinic today?
It went well. The doctor explained all the results, and now I finally understand what's been happening to me.
What did they say?
I have hypothyroidism, specifically Hashimoto thyroiditis. It's an autoimmune condition, but the doctor said it's very manageable.
I'm glad you have answers now. What's the treatment?
The main treatment is this medication, Levothyroxine. I have to take one tablet every morning on an empty stomach, at least 30 minutes before breakfast. It replaces the hormone my thyroid isn't making enough of.
That sounds straightforward. Will it help you feel better?
Yes, but it takes time. The doctor said I should start noticing improvements in a few weeks. They'll check my hormone levels again in about 6 to 8 weeks to adjust the dose if needed.
Good. It's reassuring that they're keeping track.
There are also some lifestyle things I need to work on. I should eat balanced meals, stay active, even simple walking helps, and avoid taking calcium or iron supplements close to the medication because they interfere with it. And since my cholesterol was a bit high, I need that too.
We can make those changes together. Whatever helps you feel better.
Thank you. Honestly, I feel relieved. At least now I know what's wrong, and there's a clear plan. I'm hopeful I'll get my energy back.
You will. And I'm right here with you every step of the way.
Hashimoto's thyroiditis is the most common cause of hypothyroidism in regions with adequate iodine intake. It predominantly affects women, especially between 30 to 50 years, and has a strong autoimmune and genetic background. The disease occurs when the immune system produces anti-TPO and anti-thyroglobulin antibodies, gradually destroying thyroid tissue. Environmental triggers, such as stress, viral infections, radiation exposure, and excess iodine may accelerate the autoimmune process. Hashimoto's hypothyroidism develops slowly, often over months or years. Patients may present with fatigue, cold intolerance, weight gain, constipation, dry skin, and hair loss. Cognitive symptoms like poor concentration and depressed mood are common. On examination, the thyroid may be diffusely enlarged, firm, and non-tender, or it may be atrophic in late disease. Bradycardia, delayed reflex relaxation, and periorbital puffiness may also be noted. The hallmark of Hashimoto's is elevated TSH with low free T4. Autoimmune markers include high anti-TPO and anti-thyroglobulin antibodies. Ultrasound typically shows a heterogeneous, hypoechoic gland with reduced vascularity. In early or subclinical disease, TSH may be mildly elevated while T4 remains normal. Additional tests may include lipid profile, CBC, and screening for associated autoimmune conditions. The cornerstone of management is levothyroxine replacement, titrated to normalize TSH. Dose adjustments depend on age, weight, pregnancy, and cardiac status. Patients should take levothyroxine on an empty stomach, away from calcium, iron, and PPIs. In Hashimoto's, treatment is lifelong, with periodic monitoring every 6-12 weeks initially, then every 6-12 months. Addressing associated autoimmune diseases and providing patient education are essential.